Hi, myself Dr. Atturu Haripriya. Today I am going to perform complete eye examination. Is that okay with you?
Okay.
May I know your name and age, please?
I'm Aarti, I'm 24.
Before starting the procedure, make sure that the room have adequate light source and we have to sanitize our hands before starting the procedure. I already sanitized my hands. First, I'll start with distance visual acuity test. For that, we need Snellen's chart. Make sure the distance between the patient and the chart is 20 by 20. Assume this is 20 feet distance. Can you read this line? Close your eye with your hand. Read this line.
DEFPOTEC.
Switch your hand to the side.
DEFPOTEC.
The patient visual acuity is 20 by 20. The first 20 is the distance between the Snellen's chart and the patient, and the second 20 is the in which the normal eye can read. Next, we are gonna do near visual acuity test. For that, we need a handheld card. Close your eye with your hand. Can you read this?
18967516.
Switch to this. Can you read this?
18967516.
Okay. Next, I am going to do the static finger wiggle test. For that, we have to sit in front of the patient and make sure that the patient is looking at your nose. Look at my nose and close your eye with your hand and tell me the number which you can see. Okay.
1, 2, 2, 2.
Okay. Switch to the side.
5, 2, 3, 4.
This is to check this is to identify if there is any damage in the optic nerve. Now I am going to perform the gross examination of the eye, that is the external examination of the eye. For that, we have to check the eyes, eyebrows, eyelids, and also we have to check the eyes and eyebrows are asymmetrical or not, and we have to check the distribution of the eyelashes, and we have to check if there is any redness, swelling or any edema or inflammation or lid markers are present. Now I am going to check if there is any bulging is present. For that, we have to stand and we have to view the patient from the top. And can you close your eyes? There is no bulging present. Now we have to check the conjunctiva and sclera. For that, we have to wide open the eyes and we have to check the conjunctiva and also blood vessels. We have to check if there is any redness is present. And can you look up? And we have to check the sclera, and also we can see the bulbar conjunctiva, which is lightish pink, and the sclera is white, and the eyes are absolutely fine. Now I am going to do the extraocular muscle testing. For that, we have to be 1 meter away from the patient, and we have to make sure that the patient is sitting in front of us, and this is to test the cardinal fields of the gauge. Move your eyes according to this pen. By doing this examination, basically we are checking the cranial nerve 3, 4 and 6. Now I am going to do the convergence of the eye test. Look this pen. Perform direct and consensual light reflex. For that, the room should be dim and we have to stand in front of the patient and ask the patient to look through the light. For this, use the pen light. Assume this is pen light. We have to flash in front of the eyes of the patient and we have to see the reflex. For the direct pupillary constriction, the eye should be constrict according to the accommodation of the light reflex. Now I am going to perform swinging light reflex test. For that, we have to place the light on the temporal side of the head, and this is to check if there is any RAPD, relative apparent pupillary defect. For this, we have to place the light on the temporal side of the head parallel to the iris. We can see the nasal aspect of the iris. Do the same process with the another side of the eye also. Now I am going to perform the corneal reflex test. For that, we have to ask the patient, this is to check the alignment of the eyes. For this, we have to flash the light on the cornea and we can see the light appearing, the pinpoint white light can be seen in the cornea of the eyes. In the center of the pupil and both the pupils. Now I'm going to perform cover and uncover test. For that, first I will be closing the patient's eye with my hand. There is no movement in the closed eye, so the eyes are normal. And now I'm going to perform a digital tonometer examination. For that, I'll ask the patient to close your eyes, and I'll be palpating the eyelids. The eyelids are fine, there's no problem. And now I'm going to perform fundoscopic examination. For that, we have to check the light source first, and then we have to place the fundoscope in front of the patient's eye, and we have to see through it, and we can see the retina, retinal artery, retinal vein, and we have to check if there is any exudates, microaneurysms, and any hemorrhages are present. We can see the optic disc also. Thank you.